This is obviously a very complicated issue about the cost. Definitely, our medical system, despite the good quality, is not perfect by any means. And the cost is a major problem, major issue, something we face every day when we put devices in patients that are extremely expensive. And we try, I always felt personally that medicine should never be a business. It's a service. It should be done based on the merit of the needs of the patient, not based on insurance companies or drug companies or whoever tells you how much to spend on each patient. I think this is wrong. I think personally that medicine should never be a business, should be just a service.
But should it be controlled by the government? Is that what
well,
you're
there
saying?
should be some kind of control, frankly. The problem with the big government that sometimes you have a very bureaucratic system that can become very inefficient.
Sure.
And it's almost like, you don't want to have socialized medicine because we know what happened.
Sure.
I mean, I did my training in Ohio, and we used to get a lot of patients from Canada who had to wait a year and a half on a waiting list to get their surgeries, as opposed to just cross the border and get their surgery the next day. So there are definitely some advantages to disadvantages to both systems, but it's far from being perfect. I agree with the caller.
Roy, did we answer your question?
Thank you, doctor.
Hey, appreciate it. Have a good night.
All right.
Let's talk about stress and heart disease or heart failure. Is there any relationship?
I mean, we all recognize stress as a factor that increases the risk of heart disease. Unfortunately, stress is a very difficult factor to quantitate. There aren't blood tests that you can measure the stress level, and there aren't any objective way to assess it. So nowadays, even though we recognize it, it's very difficult for us to quantitate it or to do any studies that are blinded, that are objective and randomized and controlled to know what the true effect of stress. But we see it daily. I mean, we see a lot of patients, once they're under stress, everything gets out of balance. But we don't have ways to assess that.
What about if somebody looks healthy and he or she is healthy and they believe that they are healthy, but maybe deep inside that they are not? I'm talking about heart diseases or heart failures or anything has to do with cardiovascular system. Are there any signs or symptoms that they need to be aware of? That these are like hints that you need to see a doctor.
Right. Well, from a heart perspective, generally speaking, we do strongly recommend people to be physically active. Why? Number one, it makes them healthier, the cardiovascular system better. Number two, if they were to develop any heart disease, they will have symptoms enough for them to give them an early warning.
I see.
So if you exercise regularly or you walk regularly, climb 2-3 flights of stairs, and all of a sudden you start having chest discomfort or shortness of breath doing that same activity that you've been doing day in and day out, you know there's a problem. If you don't do that activity, you may not know that there's a problem until it's further advanced.
Is there any flag age? I'm talking about 45, 50?
Usually the general age that where the risk of heart disease increases, 45 for males and 55 for females.
Okay. What kind of tests people do to assure that they are healthy from inside?
They have to do the screening test. They always recommend people to have their cholesterol checked, and some patients require a stress test based on their symptoms or their risk factors.
What is a stress test?
A stress test is a test that usually is a treadmill. Sometimes could be a bike or it could be chemical that will put the heart under stress on purpose to see how it reacts to it.
So what if somebody, physically he or she cannot be on a treadmill? Is that what you mean, like
there's a chemical test. So you can give a medication that will play the role of the treadmill.
So is it as accurate?
A little bit less accurate, but it's very reliable. I mean, its accuracy about 85%.
So do you do it on anybody that asks to do it, or his or her doctor?
No, that the patient needs to be referred by their physician, and they need to have the indication for it. I mean, based on their symptoms and based on what risk factors they have.
Okay. Well, we are almost out of time. I want to appreciate and thank Dr. Asif Farhat. I know he has a busy, very busy schedule actually. Also, he has a meeting right after this show. Take it as an advice. Work out, eat good food, even if it's expensive. Do your best. Eat fruits, eat vegetables, and live a healthy life. And you may gain few more years before the end of your time. God bless you. Have a good night and take care of your family. See ya next Thursday. Good night.